Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Thyroid malignancies, and we're looking at the most commons. So what is the most common? Most common, you're writing it as MC, primary thyroid malignancy. So here the answer is papillary carcinoma. Next is the most common thyroid malignancy. Thyroid malignancy, this is associated with radiation. So it is associated with the radiation. So this is again the papillary carcinoma. Next is the most common thyroid malignancy. The most common thyroid malignancy, this is in terms of associated with the blood and the bone metastasis, which is associated with the blood and the bone metastasis. This will be the follicular carcinoma. It is follicular carcinoma. Next, moving on to the most common thyroid malignancy. The most common thyroid malignancy in iodine sufficient areas. This is going to be the papillary carcinoma. And the most common thyroid malignancy in the iodine deficient areas. So here this will be the follicular carcinoma. Next is the most common thyroid malignancy, which is associated with the multinodular goiter. Multinodular goiter. So this is going to be the follicular carcinoma. Now let's look at the most common thyroid malignancy. That is associated with the amyloid. Associated with amyloid is going to be the medullary carcinoma. Next is the thyroid malignancy, which is associated with the MEN2 syndrome. So, associated with the MEN2 syndrome, this is going to be the medullary carcinoma. Next is the most common aggressive thyroid tumor. So it is an aggressive thyroid malignancy. And this has the worst prognosis. So worst prognosis, this has to be the anaplastic carcinoma. Anaplastic carcinoma. Then we move on to the thyroid malignancy. So here in the thyroid malignancy, with the best prognosis. So which one has the best prognosis? And here it is nothing but the papillary carcinoma. So papillary carcinoma has the best prognosis. The worst prognosis we saw was the anaplastic carcinoma. To learn and grow daily like this, please do subscribe.